Hello guys, welcome back to the channel. So today we're going to be exploring Kunifa. So Kunifa Health Solutions is a healthcare organization and they have two open roles for RON. So if you're a registered nurse, this is the video for you because with this video, we're going to be talking about these two positions and it does require you to have a license in nursing. The first one we're going to be talking about is this one titled Case Management RON Specialist. They are requiring you to have a Hawaii license. Also, you have to be willing to work Hawaii business hours. With this position, you're going to be working under the direction of a supervisor, and you're going to be collaborating with medical doctors. You're going to be collaborating with these doctors to discuss healthcare plans for patients. You're going to be making sure that comprehensive assessments are being done for these patients. Obviously, this is a fully remote role, so all of these activities that I'm describing, you're going to be performing them telephonically, so they are not in person. You're also going to be providing community resources to these patients to allow them navigate their health better. With this position, one of the things that jumped out to me is that you're really going to be following up with patients. You're going to be assisting them with appointments, really just being that resource to patients to make sure that they are keeping up with their appointments, that they are taking their medication the way they ought to take them, and so forth. Really patient management, if we call it that, right? So that is what this position is. And with this position, you are going to also be working in a lot of systems. You're going to be expected to have strong communication skills, someone who is also able to be a self-motivator because you're going to be in charge of your own caseload. You're going to be tracking. You're going to be ensuring that your patients are making progress. And also with this position, if you have a social worker degree or license, you can still apply for this position. So that's another additional information I wanted to provide for this role. They do have on here CCM certification, that's complex case management certification. They're also asking for you to have some experience, 1 to 3 years, disease management as well as case management, but those are preferences. So even if you don't have that, you can potentially still get this role. You just want to make sure your license is not restricted in any way. So that is this position. And I know that a lot of times I've gotten feedback regarding like nursing. People are looking for fully remote nursing roles. This is a good one. And the salary is between $39 and $59 per hour. Again, between $39 and $59 hour. This is all depending on the experience you bring to the table. If you're someone that has no experience at all, you will fall more towards the $40 mark versus somebody that is a whole lot more seasoned. You could easily get over $50 per hour for this position. All right, so we're going to move on to the next role. It's another position that is requiring you to have a license as well. This position, the title is Revenue Cycle Appellate Clinician. They continue to look for more people to fill this role. So this is a position that has multiple roles open. They have a huge headcount that they're trying to fill. So with this position, the expectation is around performing retrospective review. So really, this individual is going to focus on patients that have been in the hospital, whether it's emergency care or inpatient admission, and really getting out of hospital. You will be the one that is going to help perform those discharge assessments. You will be the one to also ensure that post-discharge that they're able to actually follow up with their appointments to make sure that whatever was taken care of during their hospital stay doesn't come back again, and kind of just making sure that they follow up with their primary care doctor, because whether it's an emergency room visit or an inpatient admission, the recommendation post-discharge is always to follow up with your primary care doctor. So this individual is going to really work with those patients to ensure that that does happen. And in addition to that, whenever there is a medical denial for services, this individual is also going to be the person to perform the retrospective review, meaning after the services have been performed, now re-review and potentially approve those services. So that's really what this role is. With this position, they are asking for you to have some utilization management experience, case management experience. Also, they do want you to have a nursing license. So if you don't have a license, you will not be eligible for this one because for both roles actually, because they do require you to have a license in nursing. You can either be RN or LPN. Unlike the first one, which was RN specific, this one, even if you don't have RN, as long as you have LPN, you can actually still apply and potentially get this role. The beauty of this one as well is that this is a fully remote role. So I know that's something that a lot of people are in dire need of, but it's not something that is very common. But these two roles are open right now. So if any of my subscribers that are nurses, or even if you're not a subscriber yet, should you encounter this video, I hope you encounter it real time so that you can go ahead and submit your application right away, because these roles, they tend to fill up very, very quickly. And especially with Comifa right now, they are looking for multiple headcounts for this particular one, which is the revenue cycle position. The salary is a little lower than the first one, is $30. That's a starting, and maximum $46 per hour. And that makes sense because they have room to hire people that are LPN versus RN. So the RN is definitely going to fall on the higher end versus the LPN, which will be more mid-range, which would be about $35 or so. So that is it for this position. The next bonus position that I do have is with another organization, and it is with University of Miami. So University of Miami is looking for a clinical documentation specialist level 1. This is a remote position. However, it's also an entry-level role. With this position, as you can see, it is a level 1 position, and you are going to be doing a lot of data entry type of task. You're going to be making sure that information of patients are documented accurately, and also making sure that subsequent reports are generated from that data. You are going to be collecting information from patients' admission files. You're going to be making sure that any type of trend setting reports that need to be generated, you would need points for that. They're asking for a bachelor's degree, and they also are asking for a RIA or RATE certification. So 2 years is what they're asking for in terms of experience. If you have that, you are eligible. And we also talk about having some data entry experience as well. So that is really what this position is. And according to my research on this position, the salary range is between $25 to $30 per hour is the salary range. So I encourage you to go ahead and check this one out as well. So really focusing on the hospital, the different information that are being collected from patients on a daily basis, even from demographics to more disease-specific data. So that's really what this role is. So those are the opportunities in this video. I hope you find these leads helpful. I encourage you to go ahead and subscribe to this channel if you've not subscribed already. And if you're watching me for the first time, don't just watch and leave. Make sure you have your notification bell turned on so that next time I post a video, you're alerted by YouTube to check it out. Okay. Again, I want to thank you guys so much for continuing to watch these videos. Till next time, best of luck to you, and I will talk to you guys next time. Take care.